So good afternoon, everyone, and thank you so much for joining our presentation today. This is the first presentation of our Diabetes Awareness Series for the month of November. My name is Kayla Rogers, and I'm an Education and Outreach Coordinator for the Women's Fund. For those of you who are not familiar with the Women's Fund and what we do, we are a nonprofit in Houston dedicated to providing women and girls with the tools that they need to be advocates for their health. So we do this through focused seminars, curriculum-based classes, and publications. All of our publications are completely free. You can find a form on our website, thewomensfund.org, to order physical copies of our publications, or you can also visit our website to download free PDF versions of our publications. So if you have not done that yet, I do encourage that you visit our website and give those a look. Today, we have Natalie Williams here to give a presentation over diabetes. Ms. Williams has worked in the field of nursing for 35 years in the areas of high-risk obstetrics, which include antepartum, postpartum, and neonatal nursing. Her passion has been diabetes care and education specialty the past 10 years. She obtained her master's degree in nursing with an education certification in 2010 and obtained her certification in diabetes care and education in 2015. Ms. Williams has been working in an outpatient hospital-based clinic the past 11 years as a disease management consultant. The clients she manages have prediabetes, diabetes, gestational diabetes, high cholesterol, high blood pressure, asthma, and/or HIV. Diabetes management is her passion because she gets to be a part of a positive change in people's lives. Ms. Williams is married with 3 adult boys and 1 dog. She likes crafts, decorating, and organizing parties. However, that has changed due to COVID. So we are so very grateful to have Ms. Williams on our presentation today to lead this presentation over diabetes. So I'm going to turn the floor over to her.
Well, I'm so glad to be with you all today. I wish we could have met in person, face to face, because I love to do demonstrations and illustrations, getting everybody participating in it. So because I cannot see your faces, I can't judge whether or not you really understand. So, but we do have a way where you can just write your comments and questions, and we will do our best to answer those. However, if I'm not sure about a response, don't worry. I will still get back with you. Taylor will give you the information. Okay, so let's get started. So first we're looking at just what is diabetes. And on our next slide, we'll see that the learning objectives. So by the end of this session, you should be able to state what diabetes is. You should be able to identify signs and symptoms of diabetes. And I'll try to make it as simple as possible. If at any point of time you don't understand something, just let me know and I can go over it with you. It's no problem. You should also be able to state the significance of what an A1C is and list some interventions to control diabetes. Let's go to the next one. So the question is, why is this so important? Well, it's because 1 out of 3 people has prediabetes. 1 out of 3 people has prediabetes. So the prevalence is high. So the prevalence means that this is the number of times it occurs. So the prevalence is high. The prevalence of diabetes is very high. So if we are sitting at a table of 3 people, 1 of those persons will have prediabetes. And also more than 88 million people in the United States have prediabetes. That's about 33% of people. And more than 84% of them do not even know that they have prediabetes. So that's why this is so important. So more than 34 million people in the United States have diabetes, which means 1 in 5 people have diabetes. We have 1 in 3 with pre-diabetes, 1 in 5 with diabetes. And of these people with diabetes, about 80%, no, it's pre-diabetes. 84% do not know. And that's why it's so important that we understand what diabetes is, pre-diabetes is, know the symptoms so that we can not only help ourselves, but we can help someone else. Okay? So, plus controlling diabetes prevents complications. And so some of those complications could be like nerve damage. We're looking at, if you're looking at the entire body, I'm going to go back and forth between this slide and slide number 5. If you look at slide number 5, the entire body, you can go to the next slide. Well, yeah, I'm sorry. I'll go back up. Okay, so if you look at the entire body, look, you see those veins? They're going all over the body, okay? So that's why it's so important to get this diabetes under control. Those vessels goes all over the body, and those vessels carry the sugar with it. So let's go back to 4, slide 4. So that's the nerve damage. So preventing diabetes complications prevent nerve damage. It also prevents heart disease, stroke, blindness, dental disease, kidney disease, and foot problems. And we say all of those because those are the organs that diabetes affect when it's complicated, when the complications start. So if you're looking at all the vessels that goes all over the body, and the vessels are like encompassing the organs as well, then that's where the damage can happen, okay? So we're looking at preventing complications. So what is diabetes? Okay, that's the big question for you. So diabetes is actually an insulin malfunction, okay? So you should be able to tell that it is insulin that is the culprit of diabetes, not being overweight, not overeating. Those are not the causes of diabetes, although that's what we think. But you think about it. We have babies that are born with diabetes. They did not eat anything. They did not come out fat, and they have diabetes. So that's not the answer. The answer is not you have diabetes because you're overweight or overeating. That's not the answer. The answer is an insulin malfunction. So we all supposed to have insulin in our bodies. It's when we don't have enough of this insulin present or circulating in the body to help lower our blood sugars naturally. That's when we have the problem. So you can be skinny, you can be obese. That's the problem, the insulin. Okay, so overeating is a complication, not the problem. So diabetes occurs when the body does not produce insulin or cannot use the insulin it produces. So the picture we see, this is what happens in the vessels. So those are 2 veins as shown here. And inside those vessels, you see the little white dots are supposed to represent sugars. And you can see one vein has just a little amount of those little white dots or those sugars, and the other vein has a lot of sugars in it. So, and at the top, it tells you glucose in the blood. Glucose is sugar. And the other one says excessive blood glucose. Glucose means sugar, so it's excessive sugar that's in those veins. And that's when you have the problems, because remember we said that those veins circulate all over the body, all over to where we have problems if it circulates to the eyes, because that's where the vein goes. from the head all the way to the toes. And so that's the reason why you have these complications, you know, such as blindness and such as amputation, because this is the circulation that's going on with the sugar that's causing the damage. It's not the insulin that causes the damage, it's the too much sugar in the system. Any questions so far? Did we get any questions so far, Kayla?
No, there are no questions so far.
Okay, so if you all have any questions, just let me know while I'm on the line. Just let me know. I have no problem answering. Okay, so the next slide, symptoms of diabetes. A lot of people want to know, what are some of the symptoms of diabetes? Well, some of those symptoms may be subtle, or they may not even exist at all. But in knowing your body, if you know that you have increased thirst and urination, that could be a sign of diabetes, okay? But to confirm that you do have diabetes, I recommend that you always go and check with your provider. So you have increased thirst mainly because you have too much sugar. If you think about it, when you eat too much sugar, you do get thirsty. So your vessels have all of those sugars in it, and it's needing water to get rid of those sugars. And that's something that we do tell our clients, is that if their blood sugars are high, they need to drink a lot of water to get the sugars down. And then, of course, when you drink a lot of water, if you're like me, you go into the bathroom, increase urination, okay? Another symptom would be extreme hunger. And this has to do with those cells not getting the sugar inside of the cell that it needs. Let's look at this analogy when I'm speaking of this. Let's look at a tennis ball. And you want to put, let's say, some sugars inside the tennis ball, okay? And the way that you can get the sugar inside the tennis ball is that if you take a knife and cut it, and you can put the sugars inside the tennis ball, okay? So the tennis ball will represent those cells, like what we were looking at in that vein, those little red circles that we saw on slide 5. So the tennis ball would be the cell, okay? And then you want to put the sugars, those little white dots that were surrounding inside, that were floating inside of the vein. You want to put the sugars inside the tennis ball, but you can't, okay? As long as the sugars are floating outside of that cell or that tennis ball, then you get hungry. You need the sugar inside the cells to not only bring down your sugar, but also to feed the cell. If you don't have those sugars to go inside the cells, you get hungry. Although you have sugar all around that tennis ball, you have no way of getting it inside of that tennis ball unless you have that knife. That knife will represent insulin. So you need insulin to help bring the sugars inside of the cell. Are you all understanding?
Yes, ma'am.
Okay, so that's the reason for the extreme hunger. So then also people get weight loss sometimes. Fatigue, blurred vision, slow healing sores. These are all complications of the diabetes, and it shows sometimes you don't get the slow healing sores until you've had your blood sugar up to like 200-300. And the normal blood sugar is supposed to be less than 120. And then if you're getting blood sugars that's in the 200s and 300s, that's extremely high. That's when you're going to start spilling over, having an increased urination, then all of a sudden you either drink more water. It's like a vicious cycle, especially if you're getting up at night 3 and 4 times to use the restroom. This may be something that you need to talk to your provider about. Okay. Oh, another thing, I do see a lot of my patients that complain of tingling or loss of feeling in the hands and the feet. Always tell them that this is the sugar that's getting trapped at the tip ends of the toes or the tip ends of the fingers, and it's not able to make it back to circulate around in the heart. So this is one way that you can tell that maybe I'm having a little bit, my sugars are just a little bit elevated. And sometimes this doesn't happen until you've had elevated sugars for a while. Okay, so these are some of the symptoms of diabetes. And then some people want to know, do I have type 1? Do I have type 2? Or do I have gestational diabetes? I usually always tease my clients, especially when I have the males in. I always tell them that, well, you possibly could have 1, you could have 2, but as a male, not gestational. Gestational diabetes are for the women that are pregnant and they get diabetes. Okay, it's gestational diabetes is similar to type 2 diabetes. So for time's sake, we're going to talk about type 1 and type 2. And you already know gestational diabetes is for pregnant women that get diabetes while they're pregnant. It's usually type 2. So type 1, I have here no insulin, which I said before, the body lives off of insulin. It's natural, intrinsic insulin in the body. So you need to have insulin in your body for life, or to live, okay? So, but type 1, these people are born without insulin, or either they have so little insulin, it's just not even compatible to life. So these people will have to be on insulin because they don't have enough, they don't have any. So they will have to be on insulin. They cannot take the pills. The body cannot absorb those pills like it needs to because it's not an insulin. Okay, so type 1, as of today, type 1 will need to be on insulin. Okay, we don't know about 30 years down the line, but right now, type 1 has to be on insulin. Type 2 is when you don't have enough insulin. You have insulin, and all of a sudden, when you reach the age of about 40, 45, something like that, then all of a sudden your insulin drops. So you've had insulin all of this time, so you're not type 1. Then all of a sudden you drop, your insulin drops, but it doesn't drop low enough to where it's like you don't have any. You have some present. So that's part of type 2. And also another part of type 2 is that you could have enough insulin, but it's not working properly. So that could be type 2 as well. So in type 2 diabetes, you can have insulin, but it's not working properly. Or you can have insulin, but it's just not enough. It's enough for life, but it's not enough to help keep those blood sugars down. Okay. So this slide goes along with the next slide. So the next slide is, which is worse, type 1 or type 2? And a lot of people think, oh, I have type 2 diabetes, so I don't need to have insulin. Well, that's not necessarily true. If you can have type 1, of course, we know type 1, you have to be on insulin. But type 2, you may be on insulin because you're not producing enough, okay? Or you may be on insulin because your insulin that you do have is just not working properly. It's like having a key to your door. You do have a key, but the key does not fit anymore. Okay, so you can have several keys, but they don't fit. So you have the insulin, but it's not working properly. to allow the sugar inside the cells. And that's what you need. You need the insulin to allow the sugar inside the cell to bring those sugars down. If you do not have that insulin present, then the sugar stays outside the cells. The sugars will rise in your blood. And that's when you get hungry because you do not have the sugar to feed the cells. Remember, we went over that before. So if you all do not understand, just let me know and I will go back over something and maybe give another analogy so that you can understand. Okay, so which is worse? It's the one that is not controlled. So you can have type 1 diabetes and have insulin that you get 4 or 5 times a day. However, your blood sugar's in the 100s. Great, that is great. That's right where we want you, okay? So you're controlled. Or you can have type 2 diabetes, just to give you an example, and you're not taking your pills, you don't go see the doctor, you're not taking it serious, you're eating whatever you want to eat, your blood sugars are 400 to 500, you have a tingling in your toes, tingling in your fingers. Remember, we talked about that, some of those symptoms. You're going to the restroom a lot. That one type 2 person, because the diabetes is not controlled, that's the worst. So it's not about having type 1 or type 2 because you're on insulin or not on insulin, that's the worst. It's the one whose blood sugar is out of control. That's the worst. Okay. Any questions?
None so far.
Okay, so I'm hoping that you understand. Okay, so let's go and look at this test. The next slide. This test is called the A1C. Has anybody heard about that test? Okay, so this A1C is a test that's done about every 3 months or 6 months and sometimes 1 year. Okay, so it depends. If I'm the person that has prediabetes, I might have this test done like every 6 months. If my blood sugar is really out of control and the doctors are trying to control this, I may have this A1C test about every 3 months. If I just have a family history of diabetes, but my blood sugars have always been in control, then I may not have this test but once a year. Okay, but if you are a person that's trying to get your blood sugars in control, this is the test that you need to have at least every 3 to 6 months. And if it's not drawn, then you need to let your doctor know that this is a test that you would like to see where you are as far as getting better or worse or how you're managing your diabetes. Okay, so now we know A1C is done at least every 3 months, 6 months to a year, depending upon your level of blood sugar. Okay, so the normal A1C test result should be, we're looking at it like a stop sign. Normal should be below 5.7. So if you get an A1C test result back and it's 5, you're good. You're good to go. If you get an A1C test back that's, let's say, 4.3, you're good. Okay. Let's say in next year comes, you get an A1C test done and it's 5.8. Okay. Now, if you look at the chart, pre-diabetes. Pre-diabetes is between 5.7 and 6.4. And your result was 5.8. So that means you have pre-diabetes. So that doesn't mean you have diabetes. It just means that now you need to slow down. If you were like eating like a lot of donuts and drinking a lot of Cokes and things like that. Now it's a time for you to back off of some of that. Start exercising and get your A1C test done, following up with your provider, because you're trying to prevent diabetes. So this is a precautionary stage, 5.7 to 6.4%. And you may want to get your A1C test done at least every 6 months in this case, okay? Start eating healthy, start exercising as much as possible. And this test, you do not have to fast. You know how some people go in and they have labs and they tell you to fast, don't eat anything the night before. So you can or cannot, it doesn't affect this test, because remember, this test looks at labs over a period of anywhere from 2 to 3 months, okay? So it's not a test that, like you eating cake last night and then you have an A1C in the morning, it doesn't affect it, okay? Because it looks at 60 to 90 days of eating cake, not just last night of eating cake, okay? So if you come in and you tell me, oh, my A1C was 7.8 because I ate some cake last night, I'm gonna look at you and say, that's 60 to 90 days of cake, not just last night of cake, okay? So, and of course you see the red. If your A1C comes back 6.5, then that's diabetes. It's not the end of the world. It's not because you done anything wrong. It's just because the body insulin has decreased. Remember I said overeating or being overweight, those are complications. It's not the cause. Those are complications. In other words, you want to prevent from overeating. You want to try to lose about 10% of your body weight, and that will help lower your A1C. Okay, so I do get a lot of people that get so frustrated because they find out that they're now have diabetes. But it's like I always tell them, it is not your fault. It's now that you know, it's steps that you need to take to prevent complications. And then the other thing I get is that people, when they hear that they have diabetes, the next thing they don't want is to take the insulin. Well, as a provider, we will not just order insulin just arbitrarily for anybody. We're only going to order insulin in the case that it's needed. If your body is telling us, based upon your labs, if you need insulin, we're going to recommend insulin because your body is talking to us based upon your labs. Okay? Any questions?
No, ma'am.
So do we still have an audience out there?
We do.
Okay. So just if you can ask questions for your family members. It doesn't have to be you specifically. It can be anybody. Just questions that you may have always wondered about with diabetes. That's fine. Okay. Know your risk. Usually, type 1 is, they have a family history of someone in the family that has type 1, or it's race or ethnicity. Type 2, they've had a history of prediabetes, unhealthy weight. Looking at age, remember I said sometimes you don't even know that you have diabetes until around about 40 or 45. That's when the insulin in the body decreases. Because remember, diabetes is about the insulin. The insulin has decreased. Type 2 could be lack of exercise. So it's race, ethnicity, and the history of gestational diabetes. So if you're looking at this in type 2 diabetes, it's something that's in your hands that you can do to change the situation. That's the unhealthy weight, which could be unhealthy eating, exercise. Those are some things that you can change. Okay. The age you cannot change. Your ethnicity you cannot change. Okay. So there's some things that you can change in type 2, but type 1, there's if you look at it, you cannot change it. Okay. And the gestational diabetes is it's the same as type 2, except you are you're pregnant. Okay. Any questions? Okay. So how are we doing on time? Okay, we're doing okay. Okay. So some things that you can do as far as healthy eating to control diabetes. What are your food choices? What are you eating? So you must plan to eat healthy. Okay, so to eat healthy, you need to know what is a healthy diet. A healthy diet consists of, you can just about eat the same foods you were eating before. It's not like it's a certain diabetes diet that you have to go by. No. But you do need, if you look at this plate here, half the plate looks like it's vegetables. So half your plate should be vegetables. So in other words, if you have a carry out, we usually put in that larger section meat. So now we're going to put in that larger section vegetables. It's a change, but it's a change for our health. And look in the purple section, look, that other fourth of that plate, that's where the meat goes. It does not, if you're eating healthy, and especially if you have diabetes, this is how your plate should look. So this should be your first change, your healthy eating. So half your plate will be vegetables. The other 1/4 of the plate will be meat. And as far as the size of that, you're looking at the palm of your hand or a deck of cards. That's how much meat you can have, which is about 3 ounces of meat. And that includes fish. If it's pecans, nuts, or whatever, those are proteins. So you need to know what goes in those categories. What's considered as a vegetable? What's considered as a protein? What's considered as a starch? So if your plan is to eat healthy, you need to know what does a plate look like, and I'm showing it to you here. Then once you know what the plate looks like, you need to know what goes in each group. And you can go to www.choosemyplate.gov, and they'll show you the different categories of what's a vegetable, what's considered as a protein, and what's considered as starch. So that's a good place to start because we eat every day. And although we eat every day, doesn't mean that we're eating healthy. So this is a big part of controlling diabetes, is eating healthy. Okay. Any questions? Okay. And just remember to eat. This is another thing that I see that helps people. Try to schedule your meals 5 hours apart. So in other words, if you eat, so it's 3 meals a day, breakfast, lunch, and dinner, 5 hours apart. So if you eat at 8 o'clock in the morning, your breakfast, so around about 1, I think that's going to give us 1, 8, 9, 10, 11, 12. So around about 1 p.m. would be your lunch. And then around about 6, your dinner, okay? And as far as your snacks in between, in case you get hungry, make sure at least 2 hours pass since that last meal before you have a snack. And this is where I would recommend that you follow up with someone with nutrition to kind of help you manage how much of a snack you can have and how much of the starch that you can have, okay? So if you know of someone that's in nutrition, I would recommend that you follow up with them, follow up with your doctor and find out just how much for your body type that you can have, Okay. And like I said, if you do get hungry between the meals, because if you're if you're a person that likes to eat a lot all around the clock and didn't know it until you're trying to do the 5 hours apart. So just make sure that if your last meal was at 8 and you cannot make it to 1, make sure that it's at least 10 o'clock before that snack, because that's 2 hours after that last meal. That's what I was pertaining to. Okay, so another resource I would recommend is Taking Control of Your Diabetes.org, and that's TCOYD. That's a website where you can learn more information about prediabetes, diabetes, and you can connect with other people that have prediabetes and diabetes as well. Okay. Any questions about the Healthy Plate?
I have one question here. So for someone who has pre-diabetes, is there any kind of foods or habits that they should avoid that could help them to prevent that diagnosis of pre-diabetes turning into a diagnosis of diabetes?
Okay, so it's not, it's the same diet, except yours may not be as strict as someone who has diabetes, because you still have insulin, enough insulin that can carry over and regulate more sugars than the other person that has diabetes. But it's the same plate. If you have pre-diabetes and you're really concerned about your blood sugars going too far close to diabetes, I would recommend you to get a glucometer, a blood glucometer. You can find those at your retail pharmacies. The least expensive I found is like the big, I don't want to say name brand, but the big grocery store that you can find one at, and it's very inexpensive. And so you have to buy the kit, and you can check with your pharmacist about all the items that you need with it. We can look at slide 13, and that's an illustration of a glucometer right there. So let me see. And the result was 105. And so 105 is excellent because you're trying to stay less than 120. So if you are really concerned that maybe my pre-diabetes is kind of getting more towards diabetes, buy the glucometer. If your blood sugars are over 120 most of the time, so 120, 130 sometimes is okay, but most of the time, 130s, 140s, 150s, that's a little high. You're getting into the diabetes range. Okay, so I would recommend getting a glucometer if you're really concerned. But as far as the diet, it's the same diet. When I say diet, it's not like you are restricted. It's just whatever you eat is considered as a diet. So when I'm saying diet, is the healthy plate. Okay, and that's on, let's look at slide 11 again. Okay. So the diet would consist of vegetables, meat, and the starchy, the vegetables, the starch, and the protein. That would be considered as your healthy plate. So you're not as strict as someone who has diabetes, but it's the same plate. Waiting 5 hours between, and then having a snack by 2 hours after the meal if you can't wait for the 5th hour for the next meal. Hope I answered your question.
Yes, thank you.
And the other thing that you will have to do, regardless if you have diabetes or pre-diabetes, and this is something we all, well, I know I don't like to do it, but when we do get active, it's like a body in motion stays in motion. That's usually what the physical therapists tell us. So you do need to keep moving, do some type of movement. Just don't get up in the morning and then just go and sit. Just walk to your car and back, or to the grocery store and back. You're gonna have to do some additional active exercises to stay active. And you see the seniors here in the slide here. They're having weights. So about 2 or 3 times in a week, you're gonna need to do some what we call resistance, lifting some weights, and you might have to get with a physical therapist, someone with that type of background, so that you know what's your limits, and how to use the different equipment. But being active is so important. So healthy eating and being active, those are the 2 things that you will need to do, and interventions that you will need to do as far as controlling diabetes. So the ADA, American Diabetes Association, recommends exercising 5 days a week for at least 30 minutes. So always check with your provider before starting any type of exercise. Any questions?
No, ma'am.
All right, now thank you for your question earlier. And of course, follow up. So you need a healthy diet. Please go to that website that I was suggesting for you. A healthy diet, exercise, follow up. So remember, it's a partnership to better health. So you must talk with your provider regarding some risks and steps needed to prevent and to control diabetes. So you should have an annual checkup with labs. And what lab did we say that you needed? A1C. Make sure you get that lab. Okay. If you're doing your blood sugar checks and you get like 105, like this one has 105, that translates to an A1C of about 5. Okay. And if you're looking at, let's see what I have here. We said if your blood sugar goes to 126, that's an A1C of about 6. If most of your blood sugars are reading like 125s, 126, 130, that's an A1C averaging about 6. Remember, 6.5 is diabetes, so you're pretty close. So if you're in this category of getting A1C in the 6, or the blood sugars you're seeing like 125, 126, then you need to really take control of your diet and your exercise so that you can get those blood sugars down, or the A1C down. Okay. So remember your A1Cs. I know we're not talking about blood pressures and cholesterol, but when we say A1C, remember your ABC. So when we say ABC, that's knowing what your A1C is, that's the A, knowing what your blood pressure is, that's the B, and C, knowing what your cholesterol level is. So whenever you go to the doctor, and you should have an annual checkup once a year, make sure that those 3 things that you do know, because these are some items that people disregard or forget to ask their doctors about drawing. And not only that, you need to know what the normal is, and you need to know how does that compare with what yours is. And so we've gone through the A1C. So when you get your A1C results, you want to make sure your A1C is less than what? Let's look at 9, slide 9. You want to make sure your A1C is less than what? 5.7. That's right. 5.7. So when you get your A1C result back, you need to see it 5.7. And if you're in pre-diabetes, you want it to stay in that range or get to normal, okay? If you have diabetes and your A1C, I've seen people A1C up 14. If it's at 14, then it's going to take some time for that to go down, because we don't want you to go from 14 to the 6 overnight, because you're going to feel like you're on a roller coaster going straight down. So it takes a gradual time. But the goal for a person who has diabetes is to have the A1C at least 7.0. Okay, and if you see here, it's still high at 7.0, but we'll take that. We're glad to have that. And some people, depending upon the age, will say 7.5 or 8, but it depends upon what your doctor says. So check with your doctor as far as the goal for your A1C. Now let's look at slide 14, the last one. The other thing you can do to help lower your blood sugars is take your medications as prescribed. Ensure that you understand the frequency of taking medications and the amount. So many times I have clients that leave the doctor's office and not sure about how to take their medications, and worse, no knowledge on the use or the side effects. So, and this statistics show that at least 30 to 40% of the people that leave the doctor's office do not know this. So please just speak up. Ask to speak to the pharmacist to get an understanding of your medication. Your local retail pharmacist can answer a lot of your questions as well. So do not hesitate to ask. Share your feelings so that your provider can base whatever medication he or she wants to prescribe to you, based it upon your feelings and what you will actually do. The thing we don't want you to do is have medications prescribed and you're not taking them. And then you come to the doctor and we see it's not working, but then you tell us you're taking your medication, but based upon your blood work, it looks like it's not working. Guess what's going to happen? We're going to order more medication for you, thinking that the medication that you have is not working. So just be honest so that we can all work together. It's for your body, for your health, okay? It's a partnership, like we said before. It's a partnership. Okay. Any questions so far?
Yes, so we have reached the end of your slideshow. And so if anyone does have any questions at this point, you can feel free to put those in the chat. But just to kick off, towards the end here, we talked a lot about providers. And so I just wanted to go ahead and ask, diabetes, as we saw in the beginning of the presentation, really can impact multiple areas of the body. And I know that many people who struggle with their diabetes often have to see more than just a primary care provider. So what are some of the other specialty physicians or providers that people with diabetes might have to see or definitely have to see?
Okay, so you should see the optometrist, eye specialist, because remember, the diabetes affects the eyes. It affects all the veins. And so just think to yourself, where are my veins going in my body? Oh, it's going to my eyes. I think I might need to check with the eye specialist. Yes, you do. Where else could the veins be going? Kidneys. I might need to have, this is just a lab you need. I might need to have my kidneys checked, okay? And then if there's some changes in the kidneys to where the lab comes back abnormal, then you may have to have a kidney specialist, okay? Definitely you would need to have a podiatrist, a foot specialist, someone to look at the bottom of your foot, and this is something that you should do on a daily basis, because you are with you 24/7, daily. And so you can just look at the bottom of your feet, just make sure that it's not any redness or any sores there on a daily basis, and just kind of rub down the bottom to make sure. So that is a must. The eye doctor is a must. And follow up with your blood pressure is a must, because it affects the veins that in the muscles of the heart. So you want to make sure that it's not affecting your blood pressure as well. And your cholesterol. That's why I was saying it's part of the ABCs. You want to make sure that your cholesterol is within normal limits as well, because diabetes just affects all those organs.
Thank you for that. I know that is going to be very helpful for some people who may have a new diabetes diagnosis and maybe they aren't sure about all of the specialists that they should be seeing or some of the tests that they should be having done. So another question that I have for you would be about how often we should, or those with diabetes or prediabetes should be checking their blood sugar. I know you mentioned if your blood sugars are reading around 126 consistently, then your A1C would be around 6. But how often should someone be checking? And do you check before you eat or after you eat?
Okay, that's a good question. So if you have pre-diabetes, and usually a person with pre-diabetes would not have medications, or they may have just pills at this point. Okay, so you usually would check your blood sugars twice a week, and to kind of remember, we usually tell people Monday morning and Thursday before bed. So that gives you 2 different times to kind of see how your body is doing before you eat and how your body is doing after you've eaten throughout the day. So if you have, like I said, let me just repeat this again. If you have pre-diabetes, it's best to check your blood sugars 2 times a week. Monday morning before breakfast, Monday morning. And then the other one is Thursday before bed, 2 times a week. If you're on insulin, because insulin is a hormone and your body reacts to different things, situations throughout the day, and it goes up and down, it's going to be 2 times a day. 2 times a day. Once before you eat, so that's fasting in the morning, and the other one would be right before bed. Okay, 2 times a day if you're on insulin. That's the minimal. Some doctors may say 3 or 4, but to prevent so many sticks with the glucometer and stuff, we just say 2 times a day. We can get a pretty good pattern of your blood sugars from that.
Okay, thank you. So you have been working as a diabetes educator for a while now, and I guess this is more of a question around your experience. We've seen that diabetes has been linked to many other health conditions, and one of them being depression. Is this something that you see very often?
Yeah, we not often, but we do see it. Okay, and we did. Speaking of that, we did do a poster presentation on that at the last American Diabetes of Educators this past summer, and we talked about depression with diabetes. And the main thing with that is that it's not so much of depression, it's just being overwhelmed with so much, not only taking your blood sugar, but so much other things that people have throughout their lives, that now they have to monitor their blood sugars, they have to monitor what they eat, they have to exercise. It's not like a choice sometimes, it's like a must in order to be healthy. Where before, this is just something that automatically would just happen. They didn't have to do all of this to be healthy. And so it's just being overwhelmed, you know. And so they call it diabetes distress versus depression.
Okay, and that's completely understandable because once you are diagnosed with diabetes, you're right, there's so much more that you have to add to your daily routine, and that can be very overwhelming, especially if you're already someone who is super busy. Do you know of any types of like diabetes support groups out there?
Yes, I mentioned one. It's on slide 11. It's taking control of your diabetes.org. And there's another one, the diabetessisters.org. There's several of them, but I kind of like that one, taking control of your diabetes.org.
Thank you. Okay. And then before we wrap up here, I just want to ask you if there is one thing that you could tell the people watching this video, just one final thing that you really want us to take away from this presentation, what would that be?
To stay in care, to continue to stay in care. Because when you stay in care with your provider, then you will know exactly where you are as far as being to the goal of pre-diabetes, being with diabetes or no diabetes at all, no pre-diabetes at all. Stay in care.
Okay, thank you so much. We really appreciate you giving this presentation. It was wonderful. I loved all of the analogies that you used because it makes it a little bit more, or makes it a little easier for people to understand what you were talking about. I'm definitely going to use that tennis ball analogy. So we really appreciate you being here today and giving this presentation. If you think of any questions or if you have any comments after today, you know, sometimes I walk away from a presentation and I have questions later on, or I think about something a week later. You can always feel free to email us at healtheducator@thewomensfund.org. We will do our best to answer your question. And Ms. Williams, if you're open to it, we will reach out to you if we receive any questions.
Okay, that's fine.
Okay, great. And then there's a link to our survey as well as the QR code. If you take the survey today, your name will be entered into a raffle to win a gift certificate. So we would really appreciate your feedback so that we can improve these sessions for you. And then finally, please follow us on our social media accounts to see what upcoming events we have and what we have going on, as well as finding just general health education tips that we like to post on a regular basis. Next, or not next week, tomorrow actually, we have a presentation over holiday stress. Friday, we will be covering goal setting and decision making. We have repeats of these presentations next week, as well as a presentation over Alzheimer's. So I want to end this presentation by thanking our sponsor, Kelsey Siebold, for sponsoring our awareness series presentations. And I encourage you to keep up with the Women's Fund and be on the lookout for what we have coming up next. All right. So again, thank you, Ms. Williams, for joining us today, and I hope everyone has a great day.
Thank you.
Bye. I lost my